ahead and get started.
Sure.
So Chris, let's start with you. Go ahead and introduce yourself. So go ahead and tell us your name and what you're doing, what you've been doing for your capstone project.
Yeah, of course. My name is Chris Dalton. I am originally from California, now a transplant out here in Nevada, like so many others. For my capstone project, I am looking at how to implement holistic sleep interventions within the ICU setting, and trying to explore occupational therapy's role in administering those interventions and how we can increase sleep performance within that setting.
Perfect. Thanks, Chris. How about you, Annie?
Hi, I'm Annie Slagger. I'm originally from Northern Utah. I'm here in Las Vegas now for at least a little while more. My program is an educational program for hospital-based OTs and PTs, as well as OTAs and PTAs. And I'm teaching holistic sleep interventions for how they can implement that day-to-day with their patients.
Great. All right. Thanks, guys. All right, I see I'm freezing up a little bit, so if it starts to get bad, let me know and I can figure something out. All right. As far as occupational therapy's role in sleep and rest, who wants to take that? Tell me about that. What is our role?
Profound and important.
Good answer.
It's interesting because, doing research for my capstone project, I started to look at the history of sleep and OT, and originally it was classified as a ADL, activity of daily living. And then by the third or fourth iteration of the OTPF, occupational therapy practice and framework. Sorry, just stop me if I'm using jargon I'm so used to using it. It now has its own separate occupational domain because they recognize the importance of like, hey, this is maybe bigger than just an ADL because it holds a certain power over a lot of our other occupations. Very anecdotally speaking, it's self-evident. If I have a bad night of sleep, everything I do the next day is going to be harder versus if I have a good night of sleep, everything should flow pretty smoothly. So the role of occupational therapy within that, there's a lot of different domains to address it, but a lot of it's going to be education, environmental adaptation, as well as addressing what I think is becoming the more and more important aspect as more and more research comes out, the mental health side of sleep, because we know mental health impacts many facets of our life. And there's a strange connection between depression and sleep and how they cycle off one another and compound on one another. So addressing a lot of those mental health and psychosocial factors are very important for OTs.
Well, I think it's interesting how many people don't realize that occupational therapists work in mental health and that we are mental health care practitioners. So it's interesting to try and spread that knowledge. Did you run into anything at the hospital as far as any other staff that weren't OTs kind of being like, what, like sleep, what are you guys talking about? Did you run into that at all?
It's interesting because I have a mental health background. That's how I got to OT. Like it was a natural progression for me. I'm like, oh, OT works in mental health. I want to continue down this mental health path. And that's what led me to OT. And so many people didn't. And I find that interesting. And the biggest issue within the hospital, well, I mean, there's a lot of issues. One, there's just this, and I assume we'll get into this more, just like OT, yeah, sleep hygiene, we can do that. And it's very just like off the cuff of the shoulder, just like, well, no, there's a lot more to it than that. As well as this mentality of when I did my needs assessment and reached out to different ICU therapists, both occupational therapists and physical therapists, there's this sort of mentality of it is what it is, kind of like motherhood. Like, oh yeah, when you're in the hospital, you're not gonna sleep well, just deal with it. And I'm like, well, yes, there's certainly bigger challenges and barriers, but that doesn't mean they can't be addressed, So that's been a big challenge, I think.
Okay, so Chris, you just brought up sleep hygiene. So do you guys, Annie, do you want to explain what sleep hygiene is? Puts you on the spot.
So sleep hygiene is just like the healthy habits that promote good sleep. One of the biggest one is keeping your bedroom for sleep and sex. People who sleep poorly, and just a lot of people in the hospital especially, the bed becomes like the hub where you're doing everything. So you've got like your TV and your books and your snacks and your water and your phone, and you're doing everything, but that weakens that association in your brain. So your brain stops thinking of bed as sleep, and bed is just kind of like where we do everything. And that can make it really hard for when you're trying to sleep. That association hasn't been made. But sleep hygiene also is just like keeping a schedule. So like going to sleep around the same time every night, waking up around the same time every day, trying to avoid naps, not getting too much caffeine throughout the day, not going to bed hungry or like overly full with like heavy greasy food, just things like that that kind of promote beneficial sleep.
Perfect. And Chris, I heard you talking about too that there's a lot more to it than sleep hygiene. So did you want to bring up a couple of things?
Yeah. I mean, sleep hygiene is always a good place to start, but sleep hygiene alone as a monotherapy or as a standalone intervention oftentimes isn't going to be enough to get the kind of results for someone who's having a lot of difficulty with sleep loss. It could be for like good for sleep maintenance and other issues, but in addition to sleep hygiene, there's also the environmental impacts. There's also medications to consider. There's also, again, mental health. A big part of sleep hygiene is not just creating an environment, but a routine that is attached to behavior that promotes sleep. So it very much is embedded in that mental health aspect. You know, when we talk about routines, we're really talking about behaviors, and we want to encourage behaviors that promote optimal sleep performance, especially, and we also want to get rid of negative behaviors such as the ruminators and worriers that lead to anxiety and stress, which is very prevalent in the hospital for obvious reasons. That is often not getting addressed, and it's impacting all sorts of different outcomes as well as sleep.
Awesome. And so I'm curious, when you guys were doing your literature reviews and finding out more information about this, what kind of treatments help with the rumination and with those people that worry, you know, when they're going to sleep, they're going through what they have to do the next morning, things like that?
Definitely, cognitive behavioral therapy came up a lot, of just like being able to recognize what are maladaptive thoughts or what are maybe unhelpful thoughts and reframe them in a more neutral or positive light. Being able to recognize when we're having an automatic thought and evaluate, like, is this based in fact or is this based on how I'm feeling? Is there another option that might be more true for this thought? There's also a lot about mindfulness meditation, acceptance and commitment therapy, things like that.
Perfect. So go ahead, Chris.
Yeah, I know Annie and I's background research is in a lot of similar areas. I looked a lot into cognitive behavioral therapy, as well as I did some courses in acceptance and commitment therapy. And these are great because they can be used in conjunction with other therapies like occupational therapy. And they really do address, they're usually used for a lot of chronic issues, but there's more and more evidence coming out about utilizing different interventions and strategies steeped in CBT and ACT therapy that can help address some of these acute episodes of sleep and anxiety and depression that come along with a hospital stay. Yeah.
Awesome. And so like, I'm also curious about if you guys came across anything that talked about like maybe relaxation yoga, meditation, mindfulness, anything like that, breathing techniques. Did you come across any kind of research in relation to that?
All great.
Yeah. Lots. I actually took sorry, Chris.
No, go.
I took a really interesting course through occupationaltherapy.com, and it was focused on pain, but they addressed sleep a lot because pain and sleep kind of become cyclical. And they talked a lot about how, you know, if you're having acute pain, you're having acute insomnia, and both of those can transition each other into chronic pain and chronic insomnia. But he talked a lot about Tai Chi and learning movement patterns that can reduce pain and improve sleep, but also there's yoga, stretching, like prolonged stretching. He talked about Feldenkrais, which is like basically if Tai Chi was invented by a kinesiologist. So it's a lot more OT based. Talked about like breathing techniques and how a lot of patients, especially women, especially in modern society, who are taught like, oh, like hold your stomach in, like it'll strengthen your core and help define your abs, are actually breathing inefficiently. So they're not diaphragmatic breathing. And it's so interesting, the research on that, like how it's associated with pain and how it's associated with like pelvic floor dysfunction and movement patterns. Like if you're not breathing the correct way, you aren't able to learn new movement patterns as easily. So just like teaching efficient breathing patterns can help manage anxiety. It takes you out of that like sympathetic response and into a parasympathetic response, because if you're breathing mostly into your chest, like you've got all of this tension in your accessory muscles, and that can like start and prolong a stress response. So your body thinks it's like in a panic anxiety state. So just changing the breathing or doing things like gentle movements like Tai Chi or yoga can be really relaxing and beneficial, both to sleep and to pain.
So I noticed you brought up pelvic floor dysfunction, and I guess it's something that could definitely impact moms, especially during pregnancy. So I'm curious, like, what kind of role do OTs have in managing that during sleep? So having to wake up constantly to go to the bathroom, maybe having an accident, something like that.
I think we can definitely play a role. I believe, I know pelvic floor PT is a thing, and I believe there's OTs trying to like break into the like women's health pelvic floor rehabilitation type of thing. I think definitely like getting on a voiding schedule or limiting liquids at night in order to minimize nighttime interruptions, minimize nocturia or like bedwetting problems. So I definitely think we have a role in that. I'm not sure as far as like the musculature, what OTs are doing in that area.
Gotcha. And I don't know if you came across this in literature or not, and I don't even know if it's there. Is there any kind of positioning that can help to alleviate some of that pressure on the bladder? Maybe even, I guess, just not being on your stomach, you know? I'm sure that could play a part too.
Yeah, I know. I know there's like specific pillows for pregnancy that can relieve like the pressure of the fetus. So I'm not sure if that can specifically help with bladder, but it would be interesting to look into that.
Sure.
I can speak anecdotally to that, because I know I have a 16-month-old and my wife having to experience that. A lot of it is positioning. A lot of it's going to be find the position that's most comfortable for you. For her, it was sleeping on her left side with the pregnancy pillow, holding on to it. And that was even a behavioral adjustment because she likes to sleep facing out. And then if she had to roll to her left side, she normally sleeps on the right side of the bed. So she was having a hard time sleep. So we had to do like a full switch side of beds. And it was, but you know, you do whatever you can to try and get as comfortable as you can, especially in the later stages of pregnancy, where there's a lot of pressure from the uterus and the baby. And I think the other thing that OT can really play a role in, because with pregnancy and sleep loss, it's right, the frequent nighttime interruptions, and oftentimes it's the challenges falling back asleep after you wake up, like, because it's that worry rumination. It's like, okay, when am I gonna have to go to the bathroom next? When will I ever be comfortable again? What is this? There's just a lot of anxiety and stress. So teaching some of those, either if it's diaphragmatic breathing, mindfulness, whatever works for the mother or patient or whomever, to get them back into that state of relaxation and sleeping again as quickly and as efficiently as possible is sort of where I see a major part that OT could play a role.
And I'm curious, did you guys find a lot of information on apps and different programs that can help to, you know, if you're someone who worries at night? And if so, like, what kind of apps do you guys like?
I looked into a lot of like meditation apps. So my favorite one is the Calm app. Headspace is also a really good one for beginners. Insight Timer is mostly free, like really broad range of categories, but it's a little bit harder to navigate. There was one called UCLA Mindful that was totally free, but only had like 5 or 10 meditations. So I think all of those are helpful. There are also apps for like cognitive behavioral therapy that you can just do on your own and walk yourself through, where you'll like put in a little picture, like what's your emotion, and it'll kind of walk you through the steps of like, what are the thoughts leading to that emotion? Are those thoughts accurate? What's a alternative thought that could be equally as accurate? So there's definitely apps for that. A lot of them are free just on the App Store. If you type in like cognitive behavioral therapy or mindfulness meditation, you can find a lot of those.
How about you, Chris? Did you have anything to add on?
Yeah, I looked into it. To me, it's sort of like, what's your favorite flavor of soda? You know, whatever you like. There's a ton of stuff out there, and sometimes it's a bit of trial and error. Some people might not like mindfulness. I've found that when I've spoken about mindfulness to other patients of different populations, trying to really explain like mindfulness, it's not like it's rooted in Eastern philosophy, but it's really just about being present in the present moment. It doesn't have to be this big spiritual journey. It doesn't have to be anything elaborate. It's just focusing on the present moment, paying attention to your body, your emotions, your sensations in the here and now, and then trying to effectively change behavior through that practice. But really sitting down and having a conversation about like, what is mindfulness and how can it help you, will first go a long ways. And then just finding an app, or even there's YouTube channels that you can have, 10 plus hours of guided meditation or white noise or whatever the strategy may be. It's just sort of trial and error, figuring out what works best for you.
Absolutely. Something that I know for myself that I love books. I love to listen to books on Audibles. I like to read too, but I don't have a ton of time to read. So having them on Audibles, and they have an option to where you can just set a timer, and then the book will turn off when you're done. So I know that like sometimes if it's a book I haven't read before, it can keep me up. So you want to make sure it's something that's going to be relaxing, something familiar for sure. I know that our school provides a subscription to Aura for free. Did you guys get that? Yeah.
Yeah.
Have you tried it at all?
Not really. I just kind of got overwhelmed with how many options were available on it. So I just kind of set it aside, but I do have it on my phone.
How about you, Chris?
I have not tried it. I'm not as much into the apps for me personally. I think there's a lot of benefit for a lot of people. For me, when I'm restless, like my routine is I read my Kindle. Like as soon as I turn my Kindle on and I start reading, like it just resets my brain and it puts me back in the I'm going to sleep mode. I've done it every night for I don't know how many years prior to sleep. And if I wake up in the middle of the night and can't get back to sleep, I don't fight it. I just roll over, pick up the Kindle, start reading, and then I usually fall asleep pretty quickly after that. That's my bringing myself back to the present moment. That's my ritual that works for me.
So talking about apps and then devices like Kindles, can you guys talk to me about the role of blue light?
Yeah. Annie, do you want to go?
Yeah. So blue light is emitted from natural light, but it's emitted in much higher density frequencies from electronic devices. So it's a much bigger problem in modern days than it ever was before. Blue light plays a big role in suppressing melatonin, which promotes wakefulness and kind of keeps you alert and awake. So it can also be associated with like headaches, eye strain, just kind of feeling groggy the next morning if you're using it late at night. There is some evidence that it maybe plays a role in like macular degeneration over time. So there are blue light filters. Blue light glasses are sold commercially, but from what I've researched, they're not always as accurate. Like, unless you bought a really expensive pair, they're probably not true blue light filters. They're probably only like 14% blue light filters. I have a pair that I got for $20, and after I read that, I was just like, well, I might as well not wear them. But there's like apps you can put on your phone. Most phones come with like a brighter and dimmer option or like a nighttime option. That still emits quite a bit of blue light, so you can add additional apps to your phone or to your Kindle device or whatever to add more of like an orange hue or a red hue to kind of emit the blue light that's coming out. Yeah.
And then with Chris, with your Kindle, do you have like a Kindle Fire that has like all the colors and everything like a normal tablet screen, or do you have one that is like the page? I can't remember what they call it, whatever ink.
Yeah, no, mine's like the simple, not, yeah. And I think I've read about it. It does emit a little bit of blue light, but it's in such a low frequency that it probably won't play a huge role on my sleep performance. So yeah, mine's pretty simple. It's just a page, no colors, no nothing. It's just plain and simple.
I know that I would definitely recommend, if you can swing it, to have a different device than your phone or your regular tablet that has all your notifications popping up, has all those bright lights, colors, things that are overstimulating for sure. I don't know, there's a lot of people who maybe don't know our role in occupational therapy also with sensory processing. So do one of you guys want to talk about sensory processing and how that impacts us?
Sensory processing isn't one of the more areas that I'm as familiar with, but I'm in wholeheartedly agree with the no phone in bed at all, even with dim light, because as you said, it's pulling you away from the present moment. There's always the need to check your email, or if someone messages you, or you want to look at social media or whatever it is. It's all negative behavioral habits that will impact your sleep. I turn mine to go to completely silent at a certain time, and I don't look at it again until I wake up in the morning. That's my rule of thumb.
Absolutely. How about you, Annie?
Yeah, I can speak a little bit more to the sensory processing. Sensory is kind of like one of my areas that I like. So you can think of sensory processing as like a cup, like you only have so much room in your cup. Some people's cups are bigger and some are smaller, or you can think about it of like a spectrum of like low threshold for sensory to like a very high threshold for sensory. And then just all of the sensory experiences you're having throughout the day, taste, touch, light, sound, not just light, but visual input, all of those things, depending on your threshold for that, can either be really overwhelming or you can need a lot more of it. And all of those sensory experiences are important for our brain to just navigate the world and be able to self-regulate. So if you're having sensory issues on one end or the other, you may need like blackout curtains in your room or an eye mask in order to sleep. You need like earplugs or noise canceling headphones. White noise can be good, or pink noise or brown noise if white noise is too harsh.
What is I'm familiar with those?
So white noise is like all of the frequencies of sound are firing at the same time, like at the same volume. And that's like the very classic, like TV static or radio static, but that can be really harsh sounding to some people, and it can be really like grating and irritating. So pink noise is the higher frequencies are reduced. So it's a lot more of the lower frequency noises. And then brown noise is even further reduced. So pink noise would be more like waves, like ocean waves or like raindrops, and then brown noise would be even like a deeper sound, like a constant waterfall or something like that. So pink and brown can tend to be more soothing to like the human ear, where white noise can be a little bit irritating depending on your sensory threshold.
Something I was thinking about that app Aura, I've started trying to use that at night, just doing something new, going through the options, because they have like the bedtime stories, they have music, they have like those sounds, and I really like the hypnosis section. Because I've never done hypnosis before, kind of think it's one of those woo-woo things, but actually doing it, I get a way better night's sleep. It's been actually really interesting to see. And I know they talk about, they pay a lot of attention to the frequency of sound when they do those hypnosis, whatever tracks, those sound tracks. And so I usually fall right asleep, but there's been like once or twice where I've like stayed up and listened to it, and like it's really interesting. It sounds almost like alien, like when you're listening, like really ethereal, like when you have aliens come on in the movies or something. But it's really relaxing for sure. So
definitely.
Something that I've been thinking about too, though. So we're talking about using apps or blue light and also sensory processing, because I mean sensory processing is work for our bodies. So if you're trying to decompress, and fall asleep, you want to make sure that you have this restful state of the right amount of sensory for you. So just really quick before we go on to like our routines and how that's related to electronics, I just want to say for sensory, some people need things to be completely removed. Annie, like you were talking about, like having an eye covering, having blackout curtains, things like that. But something that I have found really interesting, my oldest child, my daughter, she has ADHD. And she was the worst sleeper, the worst. I mean, she would go to bed as like a toddler at like 2 a.m. and would wake up at like 5. She was the worst. And she wasn't diagnosed with ADHD until she was like 8. So we had a lot of years with a horrible sleeper. We got no sleep. And it wasn't until she was diagnosed with ADHD and we dove into that and that we found out that part of ADHD is this big sensory issue. And so kids with ADHD or adults or anyone like that who maybe aren't as sensitive to sensations, they can feel like their body is floating when they're trying to sleep, like a very unsettling feeling, like they're not grounded to the earth. And so a weighted blanket can make a huge difference, or just like a heavy quilt, having maybe like some, if the child's older or an adult is older, having some body pillows or some stuffed animals, things like that. Obviously, we don't do that with babies, but all of those things have really helped her, has completely changed it. So it's not necessarily to take away. It's also, like you were talking about, Annie, even with the sensation of sound, that can be something that you need to help you relax and fall asleep.
Yeah, definitely. They also make like stretchy material. And again, you wouldn't want to use it with like a baby, but it's like compression, but it's not weighted. So it's kind of a little bit more breathable for sleepers who get overheated easily. You can kind of like push against it, and it provides compression and like that deep pressure sensation to help people sleep.
And so I'm curious, now that you bring that up, because I still want to get to the roles and routines, but I have all these questions for you. So in relation to the ambience of the room, how about ceiling fans? What kind of temperature do we want? Because I'm thinking of that sensation, and is that going to be, I love having a ceiling fan on when I sleep. To me, that's very relaxing. I like to hear the sound of the AC and stuff. I like it. But I've heard other people talk about it and how they're like, oh, how can you stand having that? I'm like, I don't know, I like it. So how about that? Like ceiling fan or not? Temperature, where do we want it?
So temperature, there's kind of a range. I found different things in my research for like adults versus children. So the research I found for children was saying like 68 to 72 degrees. Keep a fan on, but like don't have it pointed at the kid, maybe like point it at the ceiling or something. But for adults, it was saying more like 60 to 67 degrees. So there's kind of like I don't know, if you have parents and a kid sleeping in one room, I guess you'd try and just be on the border of that. Fans is just like a personal preference. Like I have a sensory issue, like I need quiet to sleep. I need dead quiet. So even just the noise of a fan is too much for me, as much as I like sleeping in a cool environment. So really just like being able to recognize your needs or your child's needs and like what's keeping you up and what helps you sleep. There's not really like a set guideline of like fans good, fans bad. It's just kind of like what helps you sleep.
Perfect. And how do you guys feel, or what did you find in reference to melatonin? Because I know that a lot of people will take melatonin, which is a hormone that your body produces, and they'll take it over the counter to help induce feelings of sleepiness. So what did you find in relation to that?
I didn't find a lot of like definitely good, definitely bad. I found a lot more like it's helpful for these people, potential long-term side effects if you're taking it too much or if you're taking too high of a dose. The interesting thing I did find about melatonin is a lot of like sleep medication is like a higher dose is bigger effect. And for melatonin, that's not really the case. So a lot of people are taking like 6 milligrams of melatonin or 10 milligrams of melatonin, and they actually could be taking much less and still getting the same or even better effect. So people who are taking melatonin, generally what I found was the most recommended was anywhere from 0.5 up to 3 milligrams, and kind of playing with that amount and seeing like, is 3 better or is 0.5 better, is 1 better? It does take a little bit of kind of testing it out and seeing how it goes.
How about you, Chris?
I can say a lot about this, maybe potentially, I don't know, we'll see where we go. But melatonin is fascinating because we're talking about these things like environmental stimuli, light, noise, temperature. And these are all factors that play a role in our circadian pacemaker. That's the rhythm that matches our biological processes to the solar day. I think circadian's like Greek for about a day clock. So everybody has this internal circadian pacemaker. And when we're talking about things like temperature, dark, these are all things to signal like when it's nighttime and when it's start to preparing for sleep, which will release melatonin within our body. So you can always work on strengthening those processes to help a more natural release of melatonin, which will help long-term. And then also the other thing with melatonin in my research I found is much like Annie found, people take too much of it and they're taking it right before bed. When in reality, when we think about going to sleep, it's triggered by the setting of the sun. Do we go to sleep right when the sun sets? No, maybe like a couple hours afterwards. So you want to be taking melatonin usually earlier in the evening, usually like after dinner, depending on when your preferred bedtime is, but usually a couple hours before actually getting into bed, going to sleep, not right before bed, which is why people report feeling kind of groggy taking it the next day because it's been in their system a little too long. And long term, you can do a lot of behavioral and environmental things to help strengthen those circadian processes, which will strengthen your sleep drive and strengthen all that stuff and your melatonin production.
I know that my children's pediatrician, because we brought that up with them, I have a few sleepers that are not great sleepers. And the physician said that he felt like it was okay once in a while, but to not do it necessarily consistently, because there's not a ton of literature that he was aware of. But he said the worry is that if you take too much, then your body stops producing the melatonin it typically produces. And so then it's like you need more to do the same thing. And that can be more of a worry, especially with kids, he was saying, just because their body, when they're children, is figuring out how to regulate itself. So it kind of needs that normal hormonal balance. But that was just what he had to say. But from his point of view, and from what I'm kind of hearing too, there's not necessarily a ton of research on it in practice. Is that kind of what you're saying?
It's what I've read and seen. It's really good at resetting that circadian pacemaker in cases of acute sort of insomnia, like things like jet lag. When you're flying across the country and all of a sudden you're on a 3-hour time zone, that throws off your whole circadian clock. So using melatonin in a short-term duration like that for a week or so, maybe to sort of reset that clock is great. There's a little bit of research I've read that shows it's beneficial for that. But again, you want to try and get back to the natural release of melatonin and engaging in the habits and routines and creating an environment that will support that circadian clock to a more normalized schedule and melatonin release schedule.
So I'm reminded too of our rules and routines as far as, our jobs and if we're students and if we have children and how that impacts when we do things. So for example, when I get home from work at the end of the day, I drive an hour away. I have to go to work an hour away, come home, dinner, and getting everyone figured out. Have you done chores? Have you done this, that, and the other? And then I want some downtime, and you go to turn on the TV, and before it's even TV time, it's like 8 o'clock at night. And then like I see my kids want to have their downtime, and then I'm trying to get up and tell them it's time for bed, and it's stressing me out. And so do you guys have any tips or tricks for how to manage that, how to, make sure that maybe you're mindful about how you schedule things or any kind of general things that can help?
Routine is good. I think it's going to be so different across households depending on, what the makeup of that family is, especially if there's a partner, husband, wife, whatever it may be, working out a routine that allows everybody to get enough occupational balance to feel like because a major part of sleep, when we break it down within our practice theory and framework, right? It's rest and sleep. So it's not just sleep. Rest is just as important. Getting that break in the day when you just have a mental and physical break from everything else is just as important to our sleep processes as the actual sleep itself. So working out a routine that is consistent with the kids, and working out a routine that is consistent with your partner that supports a little bit of occupational balance for the both of you will go a long way, I think.
How about you, Annie? Thoughts?
When you were saying that, there's been a lot of articles coming out recently about like the revenge bedtime procrastination, where people, they don't have enough occupational balance and they're becoming sleep deprived because of it, because they feel like that period before bed, when it's just like me time, is the only me time they're getting. It's the only balance they're getting. And so they're kind of choosing to sleep deprive themselves in order to have more of that. And then that's having health effects on them. So I think being mindful and intentional about scheduling in occupational balance, that can be hard especially for parents to do, but like maybe making use of like that hour time, if you're like, I have a favorite podcast I have to listen to or something, that can help create a little bit more balance in the day that you already have going. I think that could be harder for kids though, because you're kind of have to be their scheduler as well. But yeah, like Chris said, being mindful and intentional about creating that balance.
I know some things I found in my own home that after dinner, I try to dim lights. I try to start turning off lights, start to dim lights, just to try and get that natural, okay, we're winding down now. It's getting to be bedtime, and just kind of trying to relax our bodies so there's not that overstimulation of bright lights. I also know that I'm better at sometimes than others, but sometimes prepping your dinners ahead of time. So even if it's the morning of or the night before, something like that, having it, knowing what you're going to do, maybe having stuff chopped up, having it in the fridge, and then when you go to work, putting it in a crock pot or something like that. So I really think there's a lot of things, if you really focus on it, there are a lot of things that you can rearrange in your schedule to make it more smooth. But why put so much effort into creating that routine? Because it does take a lot of effort to build a routine. Once you have it, it seems to be easier, but building takes a lot of time. So why protect sleep?
Sleep is, if you're getting not enough sleep or too much sleep, you're getting a lot of the same poor physical effects, but those are very serious effects. Everything from like decreased memory, decreased concentration, decreased immunity, increased inflammation. You're at more risk for heart disease, higher risk for stroke, higher risk for obesity. They also found like people who don't sleep, either oversleep or undersleep, are kind of naturally overeating throughout the day, just like unconsciously. Memories and emotions are kind of not being stored accurately. There's more risk for emotional dysregulation. And Chris mentioned earlier, like, sleep can trigger mental health problems, but mental health problems also impact sleep, and those can become cyclical. So they used to think it was just depression, and that's still, I think, the more common one, but like depression, seasonal affective disorder, anxiety, PTSD, bipolar disorder, schizophrenia, poor sleep exacerbates all of those. And then once they're exacerbated, they continue impacting sleep, and it just becomes cyclical until something else intervenes. As well as for neurodivergent people, autistic people, or people with ADHD, poor sleep exacerbates symptoms of those neurodivergent disorders. So if you're normally a little bit sensory sensitive, after a poor night of sleep, you're going to be a lot more sensitive, and then you're going to have a lot harder time sleeping that night, and it's just going to continue. So protecting sleep is protecting like all aspects of your health, your mental health, physical, emotional, social, everything.
And why is it, like what is the purpose of sleep for the body? Like why does it have such dire consequences if we don't get enough sleep?
So sleep is kind of your body's way of restoring things. There's this principle of like the circadian rhythms where like anabolism, which is like building up, and then catabolism, which is like breaking down. So you kind of like break all of these things down during the day, which builds the drive to build them back up, which is through sleep. So we have catabolism throughout the day that like your energy levels and your, like your muscles, everything is kind of like breaking down during the day and then built back up during sleep. Especially deep sleep, like the stage 3 and 4 slow wave, that triggers the release of human growth hormone. It triggers proteins that kind of build your muscles back up and promote healing. It triggers your immune response. So like when you're in those deep stages of sleep, your muscle tone is like completely flaccid. So like there's no tone happening. Your heart rate is super low. Your respiration rate is super low. Your body temperature is super low. And your immune system can take advantage of that extra energy that's not being expended in keeping your body tone up and your heart rate up. And it can kind of like fight off infection, identify what's going on. So sleep is like your body's opportunity to heal basically from the day that you've had or from any infection or anything going on.
So kind of all that maintenance work basically. So
Yeah.
you have that physical maintenance of like the muscles and the actual physical parts of your body, but then you also have like psychological maintenance, it sounds like, because that's going to impact your mental health. I know that for PTSD, it deeply impacts it, and we can talk more about that in a little bit. I know also in pregnancy that a big predictor of developing PTSD is the quality of sleep, the amount of sleep you get in the 3rd trimester of pregnancy. So if you aren't getting enough sleep towards the end of your pregnancy, then you have higher odds of developing PTSD after the birth. You're more likely to have traumatic birth and then be impacted from it. So it's just, there's a lot of things. It sounds like your mental health, your physical health, and even your memories. That's when your memories go from short-term memories to long-term memories. So if we're not getting enough sleep, it's going to be harder to remember things at, like if you're at school or work or just in your everyday life, right? That's kind of what happens. Okay. Anything else that we didn't talk about that you can think of?
When you mentioned specifically like the 3rd trimester pregnancy, poor sleep throughout pregnancy increases risk for preeclampsia, I found when I was researching for this. And if they have preeclampsia, they're more likely to have a traumatic birth. But also like all of those physical benefits we talked about that come from sleep, or the risks that come from lack of sleep, once the woman is pregnant, those apply to the fetus as well. So like blood pressure, obesity, stress, all of those things, if it's affecting the mom, it's affecting the baby as well.
Absolutely. How about you, Chris? Anything you want to add there?
It's hard because there's so many things that impact sleep, especially in expecting mothers. Everything I was doing a lot of research for this too. I was like, what are the specific things? And I found a lot about sleep disordered breathing. Like pregnant women are much higher risk for sleep disordered breathing. Things like periodic leg movements or restless leg movements, which can profoundly impact sleep because it doesn't allow you to ever get into those deeper stages of sleep where we get all of those benefits, such as growth hormone and recovery and all that good stuff. What I found too is interesting when I was doing the research for this, women who are in their first pregnancy are also at a much higher risk for all of this versus women if it's their 2nd or 3rd or 4th or however many children. The first time around can be particularly stressful because it's a whole new thing. It's a whole new world. It's a lot of anxiety, a lot of stress, especially depending on your life situation, whether you're focusing on having to go back to work, when you'll be able to go back to work, do you have family here? And all of this comes and impacts sleep. So there's so many different avenues to address. And it's really getting to know the mom and figuring out what's going on to help address that.
So the most common musculoskeletal complaints during pregnancy are lower back pain and then wrist pain. And there are some reasons for that. The biggest reason is you have this increase in blood. And that's why you get swollen legs, swollen feet when you're pregnant. The reason why you have that extra blood is to nourish baby. But because you have those swollen feet, legs, you also have swollen back. And so it's compressing those joints in your back and those nerves. Same in the wrist. Your nerves and your joints are very small in your wrist, so it's very susceptible of causing some wrist problems. And in the lower back, not only do you have that joint compression, you also have extra weight in front that is causing you to overarch your back, which also leads to more strain on your lower back. And there is a big connection between depression and both of these both of these conditions. So there are some things that you can also do to look at, prevent those issues. You can get some wrist braces just at like any kind of pharmacy, CVS, Walgreens, Walmart, wherever, Target, wherever you get your drugs, your medication. And you can just wear that at night, and that reduces pain. Because when we sleep, we tend to do these weird things. Like we have our wrists do weird conditions. We put our thumb inside of our hands, and that puts a lot of pressure on our wrists. So when you wear those, it reduces that strain and that pressure, and it helps it kind of calm down after it's been inflamed and painful. And as far as your lower back, you guys, Annie, you kind of talked about it, some of those positioning pillows for pregnant women. Did you look into those at all? Like, what do they have? What's available?
I didn't. I just know, like, anecdotally from all of the people in my life who have been pregnant, of like, there's a big long one that can be like shaped into any kind of pretzel-y shape, and it's apparently very popular with the women I know who have been pregnant. In terms of like lower back pain, definitely the things we've talked about, like the mindfulness meditation, breathing techniques, things like that can help manage the pain. But in terms of positioning, all I've read for like pregnancy is for like sleep disordered breathing is like side sleeping. I didn't read anything specifically to back pain.
I've also, I know there's this old school and new school work. It's an interesting time in medicine right now because there's still the old school thought of like, you're pregnant, relax, sit, don't do anything, focus on the baby. But as we know, activity is good. That's a big part of the swelling and inflammation is all that extra fluid, and muscles are the pumps of our body. And that's what gets that fluid moving and circulating. So activity is good. And, I'm not saying, go to the gym and start doing deadlifts, but you want to maintain a somewhat active lifestyle, whether that's walking or even just getting up, moving around the house. You want it to also mirror whatever your activity levels were prior to pregnancy. I'll use my wife as an example, because she's an athlete, she's a runner, she was a CrossFitter at the time, and she just continued doing all of those things up until the weekend before she delivered. And you want to try and do your best to maintain that same active lifestyle prior to pregnancy, all through pregnancy. Maybe dial it back just a touch. You don't want to, put the baby at risk or mom's health at risk. And just move a little bit. It will help relieve a lot of that pressure. And also, we know activity supports healthy sleep cycles. Activity is big for sleep. It's a big part of sleep hygiene as well.
So when we're doing activity, how do we want to schedule that in our day? Do we want to be doing it like right before sleep or earlier in the day?
Typically, from what I understand, earlier to midday. Nothing. You don't want to do activity prior to bed. And a lot of that has to do with, again, those circadian rhythms. A part of going to sleep is our body has to drop a couple temperature degrees or two. And if we're working out right before bed, my temperature is going to be jacked up. I've got all the adrenaline. I'm going. It's probably going to be harder to fall asleep. So just getting activity throughout the day, either in the morning or in the afternoon, is going to be beneficial towards your sleep.
And a good principle too to remember for moms is, motion is lotion. So the way that our joints kind of avoid friction and rubbing on each other and getting hurt is through movement. There's like a sac in between your joints, a lot of your joints, and it increases the fluid in that joint when you move it. And then that creates basically lotion for your joints. And so that can also reduce pain. Something I go over with moms too in the hospital is proper ways to lift and carry. Because during pregnancy, we do have that exacerbation of inflammation in the back and the wrist, but especially the back. The back is most women get it during pregnancy, the back pain. And if you then, are bringing the baby home and you're constantly lifting and carrying, and you're doing it in a way that doesn't protect your back, then it can keep that pain going in your back, and it can become permanent. It can become chronic. Same with your wrist, which is again associated with depression and can also lead to surgeries and hand therapy down the road and some other physical therapy, usually for the back. So that's one of those things that you just really want to make sure, like you're talking about, Chris, get those movements in during the day. Make sure that what you're doing, the way you're lifting things, especially if you already have a toddler or something at home and you're lifting and carrying baby or toddler while you're pregnant, make sure you're doing it in a way that protects your back. And there's lots of information. I have some information on my website for that. You can also just look into it on your own. Pinterest is your best friend, but that's also very important. What did your wife enjoy, Chris? How did she like to position herself, as far as, did she use any pillows or anything like that?
Pillows, yes. Like I said, her being on her left side was just a magical position. She could, especially in that third trimester, was only the left side. And I don't know the specific pillow names. I'm looking in the closet. I'm like, maybe it's in there somewhere, but it's like the big C-shaped one. I don't know what it's called, that you just hug, and it goes between your legs too, because I know it can help support opening up the hips just a little bit. Because I know she had some round ligament pain, and that helped alleviate some of the pressure and pain there. And coincidentally, I also know that gastroesophageal reflux disease is prevalent in pregnant women too. And it's very similar. They have GERD pillows that you can hold on to, sleep on your side, that help alleviate some of that GERD reflux. I know she had some of that issues too. So that was a big thing. The pillow was like the magic cure-all for her.
My last pregnancy, the whole last trimester, I was sick to my stomach. I couldn't eat like anything. I'd eat tiny little meals and I would throw up. And I had to spend, the last couple of months of my pregnancy sleeping in a lazy boy to have my head elevated up from, where my stomach was, because I would wake up with, GERD, just vomiting. And I was on like 3 different medications and just nothing would help other than the positioning. I mean, all of it together made it to where I got some sleep, but it was really challenging.
I read too, part of this, there's just not a ton of research in pregnant women and all of these specific, because it's just hard. But I read too that diets could help GERD, specifically things that are lower in phosphorus. So reducing milk, things with lactose, as well as decreasing meat consumption a little bit, can help a lot with the GERD, and during that, especially that last trimester.
Yes. And those fatty foods, those are good for you to, to break down. So during my last pregnancy, I wanted fast food. I was so unhealthy. It's just like, that's what I wanted. And I couldn't have it because all of the fat, and it would just upset my stomach even worse. So yeah, those diet modifications, that's a great thing to look into too, that if you're experiencing those GERD symptoms, try to reduce all of those things you were talking about, Chris, the high fat diets, try to reduce that. And then also you can go into your obstetrics provider and they can prescribe you medication that can help, because we also don't want to damage the lining of the esophagus. So we don't want all those chemicals, those acids coming up and just eating away at the esophagus, and in the mouth. It can cause a lot of problems, dental problems as well.
It's interesting because sleep hygiene principles, it's all intertwined. You're not supposed to have fatty foods before bed. Like if you're hungry, you're supposed to have something light, like a carbohydrates, like a piece of fruit or a bar, very similar for pregnancy for the same reasons. Because when you have very fatty, high caloric meals before bed, it just diverts a lot of those resources that are used towards maintenance of our body. And so it's interesting to see the connection between, it just reinforces everything that I know about sleep, and how even when you're pregnant, those needs don't go away. It's still the same.
Yeah. So just a couple things I wanted to touch on that we just talked about. I talked about the wrist brace. I know that they do sell some supportive devices for your abdomen and your lower back. I'm not as familiar with those. You can buy them. You can just get them a lot of places online, Amazon, I'm sure you'd be able to get it there. And you can wear that during the day. I am not aware of, whether that should be worn at night or not. So I would definitely talk to your provider about that, whether that's safe. Are you guys familiar with that at all? I'm not.
Yeah, I know my wife had one of the for the round ligament pain, because she was running. She could lift, but running was hard, I think, because of the jostling, right? The baby, and it's bouncing. During the night, I think I don't know, but my assumption is probably not wear it, because there could be other risks involved. And 2, just lying recumbent is going to naturally alleviate a lot of that weight and pressure anyways. And then finding a position, whatever it may be, should help. But it's kind of like those things, trial and error. What hurts? Talk to your physician. Some people, the bands around the lower belly helped a lot. It helped my wife out a lot during the later stages. But
yes, for sure. And they can also be worn after baby's born, and they can kind of help support then too. Just have all of your guts and all of your muscles trying to go back together like your Humpty Dumpty. So it kind of helps support that, and it reduces your pain for sure. Something else I was just going to say, are there many options as far as positioners for people during sleep. During my pregnancy, I found that just like this small little wedge pillow, I'm just putting it, I'm a side sleeper, and just putting it under my belly, and then just staggering my legs. So one, my top leg was bent forward, at the knee, and then my back leg was bent at the knee, and it was kind of more backwards towards, my midline of my body. And that was great for me, just having that little support. But like you were saying, also either body pillows or those big like pretzel-y C-shaped pillows, you can also do that. Getting your legs up can relieve a lot of that pressure on your hips. Because when you're walking around, waddling around with baby, head down in your pelvis, and you also release hormones during pregnancy that relax your joints, it creates a lot of strain and pressure. So yeah, alleviating that strain and pressure could help as well. Great. So something that's interesting that I was talking about earlier, I alluded to, is that when we sleep, we have what we call memory consolidation. So short-term to long-term memories, that when they all process, and we talk a lot about mom brain, that during pregnancy and just after having baby, that your brain is all over the place. You can't remember anything. It's, where did I put that? Scheduling this appointment. Part of that is because you have increased activity demands, meaning you have more things you have to do. But then you also have these other issues that are going to impact you. So, it's just a matter of getting comfortable, taking care of your sensory needs, having a routine, protecting your sleep. That can help your brain remember things, consolidate those memories. But then once you have baby, if you have a traumatic birth, this is interesting. You should not sleep right after, unless or until you do a specific intervention that I'll talk a little bit about. But that's because your traumatic memories are going to consolidate from short-term to long-term when you sleep. So a problem that I ran into was with nursing staff. I would be courteous, and I would usually say to them, hey, I'm going to go see room, mom so-and-so, and in this room, is it okay if I go see her? And I got a few nurses that would try to stop me, and they would say, well, she had a traumatic birth. She's resting. She's going to sleep. And I would think, no, don't let her sleep. That is the worst thing that you could do right now. So unless they need that physiological stabilization. So let's say they have a fever. If they have a fever, yes, let them sleep. That's more important, making sure their body is healthy. But if their body is good and they had a traumatic birth, what you want to do is do a 15-minute visuospatial cognitive activity. Sounds super fancy. It just means Tetris, Candy Crush, word search, something along those lines. And you want to do that with the sound off. And 15 minutes within 6 hours of the traumatic event. So the birth in this case. And then that interrupts those short-term memories. Those visuospatial, meaning like what you see, because when you have a trauma, you take in more visual information and spatial information. So like how far from where I'm at to the door, that spatial information then is normal. And it makes sense because fight, flight, flee, you're trying to figure out what is the best response for me right now during this stress, this trauma. And then your body, though, if it doesn't process those memories and kind of prune out some of those memories, then you have too many like visual, very strong visual memories and spatial memories, which leads to things like reliving the event. Like you're really like playing it like a video in your mind that you're living, or you have these like really visually rich nightmares, these night terrors. And so it's very important to interrupt that consolidation from short-term to long-term traumatic memories. So again, no sleep right after. Make sure that you get your interventions in and prevent that from happening. So it's just interesting. It's important to understand how sleep works, how roles and routines work, how you can kind of hack into all of those things to make the right path for you. It all works together, Chris, just like you were saying. So anything that you guys want to say as far as SIDS prevention? Are you guys familiar with that and sleep?
Yeah, I mean, I'm as familiar with it. SIDS prevention, I think it's pretty standard now, I think, in hospitals to educate, give handouts. And usually the big thing, which is funny, it ties into sleep, is temperature, because newborns, moms, parents, it's natural. You want to have them all warm and cozy, and be all snuggled up, but that's a huge risk factor for SIDS if they overheat. So I say, as Annie was pointing out, you want it nice and cool to sleep. Not only will that strengthen the baby's circadian process, but yours as well. It's also better to err on the side of caution, because if it's too cold, the baby will let you know, versus if it's too hot, that's a huge risk. So my rule of thumb is just to err on the colder side, because it's going to help the baby sleep. And then of course the other things, nothing in the crib, keeping the baby swaddled on their back, not on their side. And a lot of times it can be hard, because I know there's family influences or cultural influences, especially an interesting area comes co-sleeping, because I know in America, the Pediatric Association says no co-sleeping, but it's culturally very normal for a lot of people. So just knowing and understanding the risks associated with that and how to do it in a safe way, it can be hugely important.
Yes, absolutely. That's something that I always talked about with moms too, is it's SIDS prevention. And so what you're saying, also it's best to have babies sleep in the same room as mom. That reduces a chance of SIDS, but not in the same bed. And you want them in their bassinet or their crib. And that part of that is because our mattresses for adults are a lot softer than bassinet cribs. So if you go and you push on it, you'll see it's pretty firm. And a lot of that is when we're sleeping as adults and we are turning our bodies in our sleep, then there's creating pressure in your mattress, and it can cause the baby to turn. And then their face is on that soft mattress and they can't breathe because they don't have as much control about turning their heads, to side to side. So there's that. And then there's also the chance that mom and dad could roll over on baby. And then there's also, we have pillows and loose blankets that for us to come up to our shoulders, if baby's in bed, is going to be covering baby. So all of these things you need to think about. And I always tell moms, I say, I'm never going to tell you what you can and cannot do. That's, it's your decision. I just want you to have all of the factual information, so you're making an informed decision. So having baby in room, not sleeping in the bed with you. If culturally, you are into co-sleeping, that's just how you were raised, it's in your culture, I always recommend to do it in a more a safer way. So there are some different bassinets that can butt up to the bed, like attached to the bed. Like I know Arms Reach Co-Sleeper is one. There's a lot of other ones that have been developed recently. And then they also have these, like, they're not Moses baskets, but they're kind of like bassinet inserts that you can place on the bed in the middle, in between the partners, if you sleep with your partner. And that is a good way too, because it has little walls, so you can't roll over on them. And it's also a flat, firm surface. So if co-sleeping is something that you value, there are some options you can use that will help keep babies safer. But safest is back to sleep, laying on the back, in a crib or bassinet. And like Chris was saying, don't have any like stuffed animals, no loveys, no, pillows, no bumper pads if they're in a crib. It's just nothing except for what baby's in. You can either swaddle baby, or they do sell these like sleep sacks that you can put them in that are safe. So any of those types of things. Temperature, Chris, I usually tell moms high 60s, low 70s for baby. Did you look into that at all for babies?
Yeah, I think cold. So I think the research is different. Like babies, it is say 68 to 72, adults 60 to 65. I think you can go on the colder end. And if that means putting like maybe a little bit thicker swaddle on the baby, so it sort of meets a happy medium. So that way it's ideal for both the parents and the babies, is probably the way to go. Yeah, so just cold, not too warm, not direct air on them. The other thing, speaking from my own experience too, was pets. I know that's why we used the Halo, the in the bed sleep, where it's between us, because we had a large enough bed and our cats were constantly getting in the crib. And that's a SIDS risk factor if the cats snuggle up to the baby and suffocate it. So that was another thing we had to consider as well.
Absolutely. And that is something, pets. So if you have dogs, you have cats, especially cats, who typically will jump on the bed Are you guys still getting me? Did I freeze?
I couldn't tell. I saw you guys freeze out when I was talking. I was like, oh no, am I freezing? Who's freezing here? I don't know.
It's me. Sorry, guys. My internet's playing games on me. But anyway, so like pets, that is something that you also have to consider. So dogs, cats, especially cats who jump and get into furniture. And so just make sure that wherever baby is sleeping, that the door is closed with the animals out, preferably. That is the safest as far as that goes. Also, pacifiers. There are pros and cons of pacifiers in general, as far as oral health, but we do know that pacifiers help prevent SIDS. So if you give your baby a pacifier, babies don't like all different pacifiers. So, having one of, I think there's like 4 different nipple shapes, going in and trying to find one of each different nipple shape, and you can try that out with baby, and they usually find one that they like better. So that's something to consider. I know that circulation in the room, there's some research on that having a fan on in the room to circulate the air helps prevent the risk of SIDS. So anything else you guys can think of that we didn't touch on?
I came up with a couple in my research process that I hadn't heard of before. So one was following a routine vaccination schedule was found to be associated with reduced incidence of SIDS. One was like, it said it's different in different countries, but in some countries they recommend breastfeeding for at least 2 months to reduce the risk of SIDS. It did not specify which countries they recommend that in. And then avoiding the infant being exposed to secondhand smoke, alcohol, or illicit drugs.
Mm-hmm. Yep, absolutely. Because these babies have brand new bodies. When they're in the womb, they're not breathing, obviously, so they don't have the practice of using the muscles and then the suck swallow reflex, especially when they're brand new or if they're premature. So meaning that you have to coordinate your breathing with your swallowing, because you have one mouth, one throat, but then you have 2 pipes. You have your windpipe and then you have your food pipe. And so you need to make sure that you can shift in between them, and very young babies struggle with that. So, all of those things, absolutely. If you have smoke in the house, it's going to make it more difficult for baby. And I'm assuming that illicit drugs, alcohol, marijuana in states where it's legal, I'm assuming that can inhibit parents and make it, less like they're going to sleep like the dead. They're going to have a hard time knowing when baby's crying, when baby's getting harmed, all those sorts of things. All right, so all of those were great things. Thank you so much for looking into that, Annie. I really appreciate it. I wish I would have known some of those. Those are great ones I didn't think of with moms. All right, so talking about co-occupation. Co-occupation in occupational therapy is when you have meaningful activities that 2 people do together. So for example, sex can be a co-occupation. Breastfeeding can be a co-occupation. And for moms and new babies, sleeping is a co-occupation. You guys are on the sleeping schedule together. Usually you hear the old adage, when baby sleeps, you sleep, right? In order to get that rest. And that usually is how moms need to routine their day in order to get enough sleep to, get all of those processes to control their mental health and their memory consolidation and all of that. So how can we encourage this co-occupation between mom and baby? What do you guys think? Any thoughts there?
There's a lot of thoughts. I know you want to do as much as you can to strengthen the baby's sleeping independence right away. You can't do the cry it out right away, but you want to do things to encourage them learning how to self-soothe, like putting baby to sleep slightly drowsy. You don't want to put the baby to sleep passed out cold, because then they wake up and they get scared. So putting them to sleep, allowing them to kind of put themselves to sleep a little bit will help that process. So maybe you don't have to get up as much in the morning or in the middle of the night. The other thing, it depends on the family dynamics. If there's a partner, co-parent, really work out a routine that works for you two. I know that my wife and I, we had a split night shifts. Very much so. I had the first half of the night up until 1 or 2 a.m. whenever the first feeding was. And then she had the second half of the night until the morning. And it wasn't so much, for me, it wasn't so much as about getting, a solid 4 or 5 hours, whatever that may be, but also being able to just like, I'm not on shift right now. I'm done. Just like when you get off a work shift, I am done. I'll even go to the next bedroom. If there's some emergency, come get me, of course, but like, I'm done, I'm tapping out, it's your turn. And vice versa. I found that to be really helpful if there is a co-parent, just really communicating and allowing mom to have that like uninterrupted 4 or 5 hours, however long it may be, of solid sleep before you tap out, can be hugely beneficial.
Well, and this is so important. I agree with you, Chris. This is something that I would always point out, especially to first-time parents. I'd make sure when partners were there, I would really dive in and I'd say, it can be very tempting as a woman. Most women work up until they have their first child, at least. And then all of a sudden they're at home and they feel like they're not accomplishing anything or they're not pulling their weight. And so it's very common to see women who will overextend themselves. So they're trying to have the house perfectly clean. They're trying to have dinner on the table before partner comes home. They're trying to have baby perfectly bathed, dressed, and happy. And then in the process, they lose their own occupational balance. So when we talk about occupational balance, there are 9 different occupations that the AOTA, so our body, right, like our professional, what is it called? Professional organization in the United States for occupational therapy is the AOTA. And what they say, I lost my train of thought. What was I talking about, for heaven's sake? Lost it.
Co-occupations, when the mom does everything. Yeah.
No, I don't know. I lost it. It's gone. Bye, guys. But no, there's so many things that can help moms with co-occupation. There are so many things. A lot of it is that routine. Oh, that's what it was. I was talking about moms having all of their occupations. They need to have that balance. It's very important for their mental health and also for attachment between mom and baby. So we have 9 different occupations, and the AOTA recognizes 9 different occupations. So we have activities of daily living, that's taking care of our bodies. We have instrumental activities of daily living. That's like chores. That's taking care of the home, cooking, taking care of children, animals, things like that. And then we have health management, which is our newest one. So that's scheduling doctor's appointments, exercising, managing what we're eating, and our nutrition. We also have social participation, we have work, we have education, rest and sleep. What did I miss, guys? There's some more.
Leisure, play.
Leisure and play. There you go. Yep. And so all of those are really important for us at every stage in our life. It's not just for kids. And so adults do play. And the difference between leisure and play, for example, is leisure is typically something that you do to feel like you are accomplishing something just for you. So for example, I would consider, I love to hike. Hiking for me is my leisure, and I feel a sense of accomplishment and empowerment when I do that. Especially, you go further and further. You go from, maybe you start off with 1 hour, then you're able to do 5 hours and on and on. Whereas play is something that is just done creatively. So like, I just out of nowhere, I'm going to draw a picture just because I enjoy that, or I'm going to make up a story with somebody. Adults often play in sex. That's where they get a lot of their play. So we need to make sure we have this occupational balance for moms, that just because they had a baby, they don't stop being human beings. They're still occupational beings who have needs. And we see it a lot with first-time moms, to where they give up all of their occupations and it's just IADLs. And by IADLs, the instrumental activities of daily living, all of their chores. That's what their life becomes. So it's super important that we protect all of the occupations for mom. And so partner, it's very important if you are able to, if you're living in the same home, that you take some shifts, right? Like those sleep shifts. I like what you said, Chris, because when mom's home, even if she's not at work, she is working hard, and her body's trying to recover. She has a very demanding baby and they're all trying to figure each other out. So when you come home, I would suggest the same, Chris. Make sure that, you're splitting food, food duties, all those chore duties, that you're taking care of the baby in the night, things like that. And also, it's okay to not have a perfect home. When you first bring baby home, that's okay. It's okay to have a little bit of a messy home. That's not going to hurt anybody, So all of those things. All right. Can I say
a couple things really quickly?
Yes, of course, Chris.
Sorry, you're just, you get my train of thought going. And I think it goes back to some of what you said about prep work as well. Having that structure between parents can go a long way to reducing anxiety. If you have everything laid out, ready to roll, you don't have to always be flying by the seat of your pants. And also the way I framed like splitting up occupations and shifts is from the dad perspective, from the co-parent perspective. I view it as I'm sort of I'm behind in the bonding process. Mom had, 9 months of bonding time, and I did my best to talk, touch, communicate. But I really viewed those shifts as like, all right, this is my opportunity to have like lots of bonding time. Like, absolutely, I will change diapers because that means I get to bond with my son. And I think it's really important to frame it in the right mindset for the co-parents. It's not just like, all right, I'm on shift now. It's like, no, this is your opportunity to have bonding time with your child, and it's going to pay huge dividends later down the line. So that's how every time, especially when it was tough, like, all right, this is my opportunity, is what I kept telling myself. This is my opportunity to like get to know my little guy a little bit better, have him get to know me, and so forth.
Absolutely. I love that, Chris. That is a great point. I know that my spouse had the same thought pattern. We had a couple of kids. There's one in particular he had to work really hard with because she just did not care for him. And he saw it as this like very rewarding challenge. And so when he got her, like, she's daddy's girl. That is her role now. He is just so happy and fulfilled with that. So I love framing it as something that is an opportunity. It's not something that's a punishment or something that's negative. I love that. Some other things that I think can help is even thinking about, your sensory needs. I'm very sensitive when I sleep. If the door opens, if pressure changes, if I hear a little sound, I'm waking up. So we put the bassinet on my spouse's side, just because he can sleep through the grunts and the little noises. I can't. So even just where you position the baby, are they, nearest to the bed, furthest from the bed, all those sorts of things. Did you have any more that you wanted to add, Chris?
Yeah, sensory is huge because I'm the same way, like the littlest noise. That's why when my shift was over, my opportunity was over. I had to go to the guest bedroom a lot because even though it wasn't on me, I just can't help it. If he's moving or he cries, I'm going to be up. So just recognizing that in yourself and then just creating the distance if necessary. And like I said, I was always there if needed, but a lot of times that meant I had to like fully distance myself when it was no longer my time to look after him during the night, because I would still just not sleep if I was right next to him.
Something else, as far as with, the postpartum period, that's the first, little while after giving birth, and the maternal period is during pregnancy in the first year after. So right in the postpartum period, especially in those first 6 to 12 weeks, depending on what kind of birth you had, you're not supposed to be having sex. And that's so your uterus has a chance to constrict and everything has a chance to repair. If you had sutures from like an episiotomy or a tear in your perineum, like that gives your body a chance to restore. So it's important that you do that and that you don't have sex until you're cleared by your physician. But I do know there are parents that have some, they have a hard time with that because that's the way that they connect with their partner. That's the way that they relax. It's very common to use masturbation or sex as a way to relax before falling asleep. And so something that I talk about with moms is, follow the guidelines from your physician, but you don't necessarily have to have sex to get that ADL, so the activity of daily living of sex. You don't necessarily have to have penetrative sex, so penis and vagina sex, in order to have that experience and that fulfillment. So there are things that you can do as far as if you want to do even just cuddling. I mean, it can be masturbation, it can be mutual masturbation, all sorts of things. That's all part of it. So think about that. And also I know a lot of moms, there's other moms who want nothing to do with that. That was traumatizing for them. They just had a baby. They want nothing to do with it. And so I think it's just about figuring out what works for you in that interim period and maybe kind of moving back up towards full penetrative sex when the physician says you can, and when the woman is comfortable doing it again, because it can be traumatizing in and of itself. So all of those things are things to consider. Anything you guys want to add on that?
No,
I was just going to say, if you have your village, use them. I know like in my religious and family culture, it's very common for us, like if somebody's having a baby, we're making meals and we're volunteering time. And there's a lot of time when people are like, oh no, like I'm good. Me and my husband have got it, or I've got it. Like you don't always have to have it. And there's no shame in accepting that help when it's offered. So utilize that. If there's somebody, obviously you don't have to utilize that if you're not comfortable with it. But if there's somebody who's like willing to watch your baby for 2 hours while you take a nap and you are comfortable and trust them with your baby, use it as much as they're willing to offer it. Like, put yourself and your sleep needs first, and don't feel like guilty for having that support system.
Absolutely. It's something that I ask every parent. I say, we go over transition planning, and I ask them questions like, do you work? Do you have babysitting, daycare set up? Do you have other children at home? Do you have dogs, animals at home? And I also talk about, do you have supportive people? Do you have lots of family and friends in town that can help you if you need it? And I typically get a yes. There are some times when it's a no. I found military families who are living off base have a hard time getting support. But I talk about the importance with them of having some people that they trust, even if it's just a neighbor, because it can be very challenging when you bring baby home. I mean, it can be overwhelming. And something that happens when we start to get stressed, if we let it get to like this climax, then our body floods with hormones, stress hormones. One of them is cortisol, and that kind of puts you in the fight, flight, or flee. Right. And so if you get up to that apex and baby's driving you bonkers, won't stop crying, is upset, and you're at your wit's end, that is a very bad situation. So what I always suggest with parents, to be aware of your body, look for signs of stress. Is your stomach clenching? Are your shoulders up to your ears? Do you have tension in your jaw? Any of those things. Is your heart just going? It's just beating really fast. As soon as you notice it's starting to happen, it is okay to put baby back to bed, right? Even if they're not asleep, even if they're crying, in a safe environment. So like their bassinet, door closed, no animals or other children in the room, and go somewhere quiet for 5 to 15 minutes, and do breathing patterns. That's what I always tell them. It's that relaxation, because part of this is rest and sleep. It's not just sleep. It's calming your body. Our bodies have rest needs. So going somewhere quiet, breathing in through the nose, breathing out through the mouth. So it's a cycle, right? Circular breathing. And then when it goes in through the nose, you're going in for, like, I do 4 seconds, hold it for 4 seconds, and then out for about 6. But the most important thing is that you breathe out longer than you breathe in. Now, one of my favorite things to do is to put blood pressure cuff on a mom before we do breathing. And then after we do breathing, and blood pressure always goes down. That's a sign that the stress has alleviated. And you see that within like a couple of minutes of breathing. So going into another room, getting yourself organized, do your breathing, and then when you're calm, go back in the room. If you find that you're past the point, you do that 15 minutes and you're still you have all those stress signs, that's when you call somebody, the friend or the family, and you say, hey, I just need you to come be with baby for a little bit. And there's no shame in that. That's why it's very important to have trusted family and friends, because we need people. We can't just do it on our own. In societies where we have more support for moms, they do better. They have better mental health, they have better mortality rates, and all of those things. So have them come in, and then I tell moms, leave the house. It's going to be hot here in Las Vegas real soon. It's pretty hot already. But I say, if you can, go for a walk. And the reason why I say go for a walk is there's research that shows that the act of walking in and of itself increases the feelings of well-being, alleviates stress. It can alleviate pain as well if you're having pain, pregnancy or postpartum pain. And it can also, the sun can also do that for you. So opening your blinds as well in the home, and going outside, being in the sunshine, that increases feelings of well-being, reduces stress. And then also being around green plants. Green plants have been shown to reduce pain and stress. So going for a walk is an excellent idea to calm down. And I say do that for half an hour. The reason why I tell moms to do that for half an hour is our body, when we just release all of those stress hormones, it takes at least half an hour after the stressor is gone to alleviate your body of all of those hormones, to flush out all that cortisol. And if you come back too soon, then you're still stressed and you have to do it all over again. So half an hour, go for a walk. It's great for you. Some other things you can do in the home to increase restfulness and peace. Again, open the blinds, have plants in your home. If you have a green thumb, I do not, I kill everything. But there's some ideas. Do you guys have any other ideas or anything you read in the literature about increasing the environment for rest?
Definitely, you already mentioned like opening the blinds in the morning. That's great for your mental health. It's great for suppressing melatonin and building that drive for sleep throughout the day. So especially like postpartum moms, if they're experiencing postpartum depression, there is like a tendency to kind of like nest and not open the blinds and sleep either not enough or too much. But like having that consistent schedule, like it's 7 a.m, we're waking up, the blinds are open. Get outside if you can, just for a few minutes a day, because when we're talking about like melatonin suppression, like household lights, they emit like up to 500 lux. The sun is like 150,000 lux. So that's going to have a hugely more powerful effect on your body, on your melatonin suppression. And it's going to like creating that pattern day after day is going to be really beneficial, not just for your sleep, but also for your mental health.
Good for baby too. Take baby out. Like babies need to strengthen their circadian drives as well. I think I've seen like, yeah, postpartum babies that sleep better, or babies that get outside, or even if it's indirect sunlight via a window nearby. Of course, being mindful of the desert and direct sunlight and sunburns, that is a risk for babies, but just getting them natural light and strengthening that circadian drive will help their sleep process, which will help mom's sleep process. The other thing, Elle, like you said, I just want to reiterate, it's okay to put a crying baby down. Like you really have to learn that early on. Just like, because there's times even the most Zen parent, you just can't do it. You just gotta put baby down and just walk away. It's best for everyone, and just really reinforcing that point that it's okay. It's completely fine, normal, and healthy to put baby down when you're at your wit's end.
Absolutely, because we do get in that fight or flight mode, and then there's always that risk of shaken baby syndrome. A lot of people, they just get in that fight mode, and it's not something that we think that we would do. We all think, oh, it's a precious child, I would never hurt a child, but we're all capable. We get stressed enough, we have those hormones going, that you could shake a child, and that's a real danger. So it is much more valuable and important that you get your rest, you get your occupations that you need, so you can have those healthy co-occupations with baby, which is like feeding baby, diapering baby, playing with baby, taking baby outside for walks. I love that you brought that up, Chris. Something too, I don't know if you guys came across this, but in pregnancy, baby usually sleeps when we are awake. And that's because we're rocking them. We're walking, we're up, we're moving, we're talking, and our voices are very relaxing for baby. So they're typically sleeping during the day, sleeping during the day, and then they're more active at night. So I don't know, Chris, if you saw this with your partner, but when she was pregnant and she would lay down for bed, would baby start like kicking and moving around and wiggling?
Oh yeah, we had a terrible sleeping baby. He did not sleep at all. He was very active at night, and he's an early riser. We would love for him to sleep later, but we've given up. It's just he just wakes up early. It's just they're little humans. They have their own set of preferences and wants and likes. But he would get very active at night. Especially he hated the swaddle. He hated it. He's one of those babies that was not comforted by the swaddle. He just wanted to be out and moving, which was a challenge for the first couple of months because the Moro reflex would kick in and he would just wake himself up constantly. So when we were able to finally get him out of a swaddle and sleep train him, much better. But yeah, he was very active for the first few months there.
Yes, and because when they're in the womb, when they're in the uterus and they are sleeping, they spend however long doing that, like the last few months of their pregnancy, right, of being cooked, and they come out, they're going to have a hard time adjusting, like you were talking about with your son, to sleeping at night when we sleep as adults and, people that have been born for a long time. So it is this skill that they have to learn. And so you're trying to support baby through that as well. You're trying to help train them, give them what they need so that they can regulate their sleep patterns, because they need sleep too. Their mood, babies have their own personalities, their own sensory needs, their own moods, their own energy levels. So they need a lot of sleep. Are you guys aware of how many hours per night baby needs as a newborn?
Is it 16?
16, that sounds right. Yeah, I was thinking 15. I think you're right. I think it is 16. Yeah. And it's usually, it's not obviously not going to be in one quick succession, right? You're going to be lucky to get a few hours of sleep every night. That's just the way it is. So something I would say during pregnancy, if you have a very active baby in utero, so kicking and pushing around in your stomach and it's distracting at night, don't tense your muscles, because it can be like very, physiologically responsive to just tense them because there's all this movement happening. But just try to relax, focus on other things, do your meditation. That can all help. So, well, do you guys have any other tips and tricks that you can think of? Or anything else that you wanted to add? Maybe
consistency.
Go ahead. Consistency. Yep.
Just consistency, routine, just building. Sleep is very much tied to behavior, even in newborns. So just having the routine, no matter what, always staying consistent. I think I still to this day, I say the same phrase to my kid every night before I put him down. Because that was my role. I was the sleep preparation guy. That was where I got to have my opportunity to bond, read stories, put baby down. That was my role. So I've been consistent since day one, and I think it helps to associate that behavior with sleep. Is the biggest thing.
Absolutely. And once baby, I know a lot of people, once baby's belly button is fully healed, they will bathe baby and put lotion on baby and do like little massages right before they put their, their night clothes on. And having that routine cues the baby into, okay, we're going to sleep now. My body's becoming relaxed and I'm learning how to fall asleep, right?
Bathing's really interesting too, because in all the sleep research I've done, it works well for people who have trouble falling asleep, older adults, babies, everyone, because as we've talked about a lot, temperature is very much tied into our circadian pacemaker, our circadian rhythm. And so when we bathe, it artificially increases our temperature, which then provides opportunity for it to lower. So it creates this artificial environment of, right, we're going to jack the temperature up and then it's going to slowly lower, which will then cue sleepiness in anyone, older adults, babies. I know that's why it's a popular technique to bathe baby right before bed.
And I shower right before bed, probably for the same reasons, because I have a hard time falling asleep. So that's good to know, the science behind that. And how about you, Annie? Do you have anything else that you wanted to add?
No, I think Chris nailed it. Consistency is key.
Absolutely.
Keep it cold in the room and keep it consistent.
Absolutely. All right. Well, you guys, thank you so much for participating. I'm so grateful to you guys, and I kept you longer than I said I would. So I'm going to let you go enjoy the rest of your morning.
Thank you.
All right.
Thank
Take care,
you.
guys. Bye.